Welcome to the Period Besties podcast with Stasha and Katie. Think about it as chatting with your best friends about all the TMI stuff you've never talked about before with two period coaches who've been helping hormones collectively for over 20 years now. I'm Stasha.
And I'm Katie, and we're pulling back the curtain on what it's like in the world of menstrual coaching. From puberty to menopause and everything in between, we're here to show you how period coaching can save the day. We'll share practical tips and information you can put to immediate use to improve your hormones and happiness.
We're removing the mystery, ending the taboo, and shining a light on just how powerful period coaching can be.
So whether you need period coaching or are considering becoming a period coach yourself, these episodes are going to help you. We'll share stories, coach live on air, and bring smart, savvy guests to share their wisdom too. Let's start today's episode.
Well, that was such an informative conversation we had about pelvic floor. I've known Meghan for years and she's shared with me so many things, but I felt like I learned so much more. I'm so excited for everybody to listen to this podcast.
Me too. Like, I had no idea what a pelvic floor session was like behind the scenes. I've never gone to one. So that was mind blowing for me to just hear in general, like not what I expected at all. So that was amazing and quite reassuring, frankly. And then even just like all of the different things that pelvic floor therapist can help you with, some things that never would have occurred to me that were, pelvic floor related. So I think this is going to be a big eye-opening episode for everyone who's listening. And no matter what's going on, I say have a listen to this because this might just be for you.
Yeah. And the best thing is Meghan gave very practical tips that you can do at home that are like 30 seconds, So I think that's
and for
also
anybody.
For anybody.
Problems
no
or not. Just across the board, take care of your pelvic floor. And here's some great ways to do it at home just on your own.
Yes. So listen in and let us know what you think and enjoy today's episode. Hello, everybody. Welcome to the Period Besties podcast. We're so excited to have you join us today. One of my dear friends, Meghan Kasper, is here joining us today, talking to us all about pelvic floor health, which is such an important topic that needs a lot more attention in the health field. So welcome, Meghan. We're so excited to have you here with us.
Thank you. It's great to be here with both of you.
I'm particularly looking forward to this because I don't really have a lot of pelvic floor therapy knowledge. So I feel like today is like a special day for me where I get to learn a ton.
Wonderful.
So why don't you kick us off and just tell us, who are you? What is it that you do?
So I am an occupational therapist by background, and I was in the traditional rehab setting for most of my career. And about 6 or 7 years ago, I really decided to leave the healthcare system and focus on body work. I'm a massage therapist as well, and I really started diving into John Barnes' myofascial release work. So I went out to Sedona and took a course, a women's health course on how myofascial release could help women's health issues. And I was just like, I don't know a woman who wouldn't benefit from this work. And I thought that I was going to leave healthcare, but I then learned that occupational therapists can do this work. So I took the more biomechanical rehab course versus the more holistic course, and thought to myself, wow, I can really combine the biomechanical medical approach with the holistic approach and really have something good happen. And so I got a job in an outpatient therapy setting, and I worked there for a couple of years and was able to see hundreds and hundreds and hundreds of women. And then realized that my approach was a little bit too holistic for most insurance companies and corporate administrators. So I decided to go off on my own. In November of 2021, I opened my own practice called Core Essence Pelvic Floor Therapy and Bodywork. And it's been going wonderful. I primarily work with prenatal and postpartum women. My passion is really working with prenatal women who have nothing wrong with them, but that really want to learn how they can prepare their body for birth and really prepare for a better and more efficient recovery without a lot of the things that can go wrong. I do let women know birth is birth, right? We can do all the right things and our baby and our body can have another plan. So I can never guarantee the outcome they want with birth. However, I can guarantee a better recovery. And also I send women into the birth room with knowledge, and knowledge is power. And when you go in feeling like you did everything you could to help progress your baby and biomechanically get that baby through the pelvis, then I feel like there's a lot less birth trauma when you go on in with education. And postpartum women, I help with holistic healing. So just, gentle body work to mobilize and close those pelvis bones after they've been so open. Sometimes they get stuck in open birthing patterns. I do a lot of visceral mobility and belly healing, scar tissue release work, and really just teaching women breathing and movement patterns that are really going to help facilitate core healing. And also teaching them to rest and not do too much, and to, this time is sacred. And doing too much can sometimes lead to these things that we're trying to prevent. So that's my jam. But I also work with women of all ages on basic pelvic floor issues and dysfunction. And I have started to dip into a little bit of fertility practice as well, which has been wonderful.
Oh, that's amazing.
Yeah.
Just my own personal journey. I've benefited so much with pelvic floor therapy. Meghan's actually helped me and, guiding me on my own journey with fertility and pregnancy and postpartum, and life-changing. Even though I had a C-section, that postpartum recovery was so important and so needed. And something that I discovered in my own journey was that so many women who've had C-sections were not getting rehab after at all. So I had been working with a pelvic floor therapist in LA, and you can barely see my scar. And I have such mobility that when I went and moved and the new therapist looked at it, she was like, wait a second, you had a C-section?
Yay! I'm so proud.
So it's fascinating. And one of the things that we see often is that in women's health, there's not enough information being talked about with all modalities, right? So even when I went for my 6-week checkup, basically my doctor was like, okay, what kind of birth control do you want to go on? And I was like, let me tell you what I'm planning on doing in my recovery. I have an appointment with my pelvic floor therapist right after this. And one thing that I want us all to think about today is sometimes this is it might seem TMI, but I think it's also that it's not being talked about enough when you go to women's health, whether it's for pregnancy, fertility, or endometriosis, or just having painful periods, or women that have had kids and still have back pain and they're 50, 60 years old. Mm-hmm. So that being said, how do people find you? How do we talk about this more? How do we make this a bigger conversation? I know Meghan and I, we've talked about this a lot, but I want to hear what you think, since you're working probably with doctors. Long question.
So there's still a lot of work to be done. I laugh because, I'm in my mid 40s. And so social media, like Facebook is my thing. And a lot of my younger, the women having babies now are no longer my age. Well, some of them are, but they're 10, 12 years younger than me. And they are getting their information from TikTok and Instagram, and they're diagnosing themselves, and they're learning more than they're learning at their doctor's office on these modalities. So I joke that I probably am going to have to get on them soon. But there definitely needs to be more education. There are some physicians out there that are proactive. Katie, you and I work with one of them, Dr. Chun. I mean, he sends his he's out of Woburn, Massachusetts. He sends his clients to pelvic floor therapy pre-birth to prepare for birth. He sends clients that have had a difficult trauma to pelvic floor therapy for processing birth trauma. And there are a lot of physicians who own that. Their job is to keep us well, right? And fortunately, in this healthcare system, they don't have the time, nor do they actually have the education about really how the pelvic floor functions. That's the therapist's job. So it's really just the physician's job to understand how we can help all of the issues that they diagnose. It's not their job to provide that information. What would be nice if they didn't just tell people who have pelvic floor dysfunction to drink wine or do Kegels. That would be really, really wonderful. And it's hard because I know that I know of nurse practitioners in the area who are recommending Kegels, and it's our job to sort of educate those physicians and those nurse practitioners about what pelvic floor therapy really is. And Kegels is a very small, not common part of it. So I think that women just seeking education and looking on Instagram, looking on TikTok, asking their doctors, and telling their doctors if they've had very good luck from pelvic floor therapy. A lot of my referral systems are from physicians I've never met because their patients have gotten better. Mm. But it's true. We have a problem in our country. Katie, I love what you said to your doctor, because if somebody goes in for a total knee replacement, they often get prehab education. They have automatic physical therapy within a day or two after their surgery. They then go to home care physical therapy, and then they get outpatient physical therapy. And they're not allowed to resume certain activities and movements for multiple weeks. Hip and abdominal surgery, same thing. We can be talking anywhere from a 6 to 12-week recovery. And a woman has a C-section, and then the doctor says, okay, go exercise and have sex, do whatever you want. And that's when a lot of the injury is happening, because there is a very big difference between going for a long walk with your child in a stroller and going and doing a CrossFit or HIIT routine. And the deep core is not ready at 6 weeks. It's not ready at 12 weeks. And for some people, it's not ready at 4 or 5 months postpartum. It is very different. And I can look at a mom 5 weeks postpartum who's ready to resume certain level of activity, and a mom that's 18 weeks postpartum who isn't even close. So I digress, which I do a lot, but really I feel like the consumers being educated is the best thing that we can do right now. And they're starting to seek it out. I am getting phone calls for prevention, and it lights me up. It makes me so happy.
I completely concur. I harp on with my students. You want your clients to talk to their doctors. You want them to keep their doctors in the loop, because when it works, you want them to go to their doctor and show them. You want them in the loop. Because this is how we change the system, is just proving it over and over and over again. So for all of the, anti-medical establishment, which I understand, I too had a lot of medical trauma from having endometriosis as a teenager, and just being told, well, you're I don't know what to tell you. You can't have endometriosis. It takes years to develop. So that's not what's wrong with you. So I don't know what's wrong with you. You must just be fine. It must just be in your head, or, all the various things that I was told over the years. So I was very skeptical of, the medical industry, because it was useless to me for something that was causing me such pain that I was suicidal every month, looking down the barrel of 40 years. Right. So I just thought, very anti. But then as I got older and started to see things differently, and realizing if we really want to make a difference, we really have to make that difference in the medical world as well. And as hard as it is, there's different ways to do it. People become doctors and try to change the system from within. But I think patient advocacy, going in, telling your doctor, this is what I'm doing, this is where I'm at now, this is where I'm at now, and continuously informing them as things improve and get better, forces them to go, oh, well, I guess that worked. And then 2 patients, and then 3 patients, and then 4 patients. And eventually they kind of have to go, oh, all right, maybe they're onto something. So I fully concur with what you're saying. I do have a little bit of a question. I think that we often think of these things from fertility and pregnancy standpoints, which is fine because that's usually socially acceptable to talk about. But what are the things that people can benefit from that are like the TMI or the taboo things, like painful sex, right?
Yeah.
That's something that I know for sure that can be helpful, but that's something that people don't really like to talk about. So what other like taboo conditions or something that somebody might feel shamed or embarrassed about that they would have no idea that this could help them?
Sure. I just want to, before I answer that question, I just want to comment on painful sex. Painful sex is one of the most isolating issues. I mean, people are different. Some people are very extroverted. I have had friends that have experienced painful sex, and I've known about it for years. I've also treated women who have not been able to have sex with their partner for 20 plus years and have never told a soul. And it's very, very, except obviously their partner, but it's very, very, very isolating. And I just want to send a message to anybody who's experiencing painful sex that you aren't alone. It's not normal. It shouldn't hurt. It should feel, are we allowed to swear on this? Effing amazing. And that there are things that you can do that are not Kegels. It is a multi-system approach. It is biomechanical, it is mental, it is nervous system, it is our sensory system, it is our belief systems. So there's so much that you can do. Other issues that pelvic floor therapy can treat are most people know that we treat urinary leakage, so urinary incontinence, whether that's when you're peeing your pants from movement or stress incontinence, like coughing, sneezing, laughing, or if you just can't quite make it to the bathroom when you pull into that driveway. We also treat bladder pain or interstitial cystitis. I believe interstitial cystitis is that actual title is sort of being weaned out and it's being called bladder pain syndrome. But people who feel like they just always have some form of a UTI, they've taken so many antibiotics, the doctors are telling them they don't have a UTI, but they feel like they have a UTI. I have those clients actually can be helped quicker than they think if they really do the work. I've seen that improve in as soon as 5 visits. And that's something that people have struggled with for years and years and years. Any kind of pain, vulva pain, vestibular pain, internal pain. It doesn't have to be just pain with sex, pain with urination, pain with bowel movements. Constipation is probably something that so many women struggle with and don't know that pelvic floor therapy can treat. And so I've had really, really, really great luck with my clients with constipation. The best email I ever got was a woman who was traveling with her family, and traveling is such a trigger for constipation. And she was in tears, happy because she pooped in an airport, and she usually doesn't even poop on vacation. So these taboo things really impact our life. It doesn't sound like a big deal to feel like you have to pee all the time. But if you can't go watch your children play soccer because you have to go to the bathroom every 20 minutes, it really impacts your life. I also treat urinary urgency and frequency. So maybe you're not peeing your pants, but maybe you're peeing really frequently. There's a lot of habits that we develop, especially if we have children, just in case peeing. I'm just gonna go to the bathroom. And that's fine. We have to do that sometimes. I do that sometimes. But then years later, we can get into the habit of just in case peeing all the time. And that really changes the feedback loop between our bladder and our brain. And our brain starts sending us signals that our bladder is completely full when it really is only 25% full. And we then believe that we have a small bladder. Then we go to the urogynecologist or the urologist who do all of these invasive tests that can be traumatizing and then tell us nothing's wrong. And there's just so many simple life hacks that can help that. Bowel incontinence. Bowel dyssynergia. So some people actually have difficulty with pushing their poop out. Their muscles are not coordinating well with the brain, and they have a hard time lengthening their pelvic floor. And what else do we treat? And we do treat endometriosis, period pain as well.
Yeah, I've seen a few of my clients and friends in LA that I have recommended to go to pelvic floor therapists for endometriosis, for period pain. It's been life changing for them. Like, it's amazing. They can go for a walk when they get their period.
Yeah.
It's amazing. I love it. I send a lot of my clients, and a lot of my older clients too that have had kids and never got therapy postpartum, that are experiencing knee pain and back pain, and doctors want to, have knee surgery. And I was like, wait, just try this for a few months, see if this helps.
Yeah.
And for a few of them, it definitely has.
Yeah.
Yeah.
And I want to say to people who are listening to this who have gone to pelvic floor therapy and did not have good results, to just not give up and try another therapist. Just like all therapists, doctors out there, everybody's not right for everybody, right? And there are different schools of thought when it comes to pelvic floor therapy. And you're never going to find two pelvic floor therapists the same. There is so much education available to all of us, and people specialize in different things. I specialize in manual therapy, and I'm really starting to change my practice into working with trauma. And then there are some therapists that don't really use those modalities. And so they might not be the best person for the patient with endometriosis or the patient who has birth trauma, but maybe they, have leakage and they're going to see a more biomechanical therapist. And so if you went to pelvic floor therapy and you felt like they only give you Kegels and it didn't work, then I just encourage you to research, ask people in your community, and find a different pelvic floor therapist, because no two are the same and people have different strengths. And, I think everybody has good intentions, but there are some people, pelvic floor therapy has changed so much in the past 10 years that there are some therapists sort of doing the older stuff that helped, right? But there's so much newer information out there that newer therapists are using. So I just want people to not give up if they have had not the best experience, and try somebody else.
I agree. That was my experience.
Yeah, I think that's sound advice across the board. I say that all the time about period coaches. Like, everyone has different obsessions and modalities, and you should shop around. You should find the person that you jive with and that you feel like it's good and seems to be something that's helpful for you. And if it doesn't work, try again, kind of thing. I love that. Also, while you were listing all that stuff, my brain was like, I need to text so-and-so, 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 so-and-so. I'm sure my friends tell me more of these TMI things than an average person because of the work that, we all do. We probably all get that. But my brain was basically making up my group text list as you listing.
And one thing that I forgot that's really important, and it's not the pelvic floor so much as I treat diastasis recti a lot. So the ab separation post-pregnancy is one of my favorite things to work with as well, and pelvic organ prolapse. So when the organs kind of cave in on the vaginal wall, or maybe even poke out a little bit through that tissue, those are also a lot of, not just postpartum, but a lot of issues that can impact the pelvic floor. I knew I was forgetting something. Sorry.
No, that's a good one. I know a couple of people that have that separation, and it's caused problems and issues over time. So I'm definitely have one person at the top of my list that I will be calling later today to have a conversation.
Wonderful.
So for many people who might not have gone to a pelvic floor therapist, walk us through, I know it's different, obviously, working with individuals, but walk us through kind of like a session. Like, if somebody is listening and is like, oh, wait, I have ABC, how can we make it more comfortable for them to see a therapist?
Yeah. So the biggest misinterpretation I think people get is, I'm going to go see a pelvic floor therapist and they're going to stick a finger in my vagina. And what are they going to tell me? That's scary. And I'm not comfortable with that. And there are clinicians out there who are getting you in, telling you what a pelvic floor does, and sticking their finger in your vagina. And I know that because that's what I did at the beginning of my career, because I didn't know what else to do, right? We all have to start somewhere. Where I am now is in a very, very different place. I always let my clients know on the telephone that pelvic floor assessment, if appropriate, is something that I can do. It is not something I have to do. There are many pelvic floor therapists out there that are treating core and pelvic floor dysfunction without doing internal work at all. So it is a benefit. It is something that can be very helpful for certain people. It is not a necessity. Patients have rights no matter where they go. And with the right therapist, they will help you figure out your stuff without that internal information. There are also ways to teach clients to do their own internal assessment and give them what they need to be looking for so that they can sort of decide, is my pelvic floor overworking and hypertonic and tight, or is it maybe on the other end of the spectrum, or is it kind of somewhere in the middle and I don't know? So my typical session, with the exception of a woman who comes in with symphysis pubic disorder or dysfunction, which is SPD pain during pregnancy, which is something else I treat, I'm going to be a little bit more hands-on, a little bit less of an assessment and more, okay, let's get you on the table. Let's find some movements and manual techniques that make you be able to walk out of here. But for the most part, when somebody comes in, I'm doing a lot of education. I'm educating them about the pelvic floor system, what its functions are, which are the three major functions are allowing yourself to completely open up to be able to pass urine and feces, and also to be able to keep that from happening when it's not the appropriate time. Pelvic floor muscles assist in supporting pelvic organs. They're not holding them up, but they are assisting in support. And also the pelvic floor is responsible for accommodating childbirth and penetration. So if penetrative sex is something that you have, being able to allow for that to happen without pain, discomfort, and also to be able to achieve orgasm. It also has some shock absorbing and lymphatic sump pump functions as well. So I educate them about that. I then go into a postural assessment, and I should go back. There's a lot of conversation. I go over their intake form. A lot of times there are things from our past that are contributing to our pelvic floor dysfunction now. And so we really, if you have constipation, okay, well, when this did this start for you? Was there a stressful thing happening in your life? Was there a major trauma in your life? Or maybe there was just a lot of stressful things and your nervous system started changing. There's a lot of information in a conversation. Hemorrhoids and anal fissures are something else that I treat. And I had a woman come in and everything was great. And at the end, she says to me, I've been eating an awful lot of almonds lately. Do you think that could contribute? And I was like, yes. Like, I don't have any evidence, but I have seen in my practice a lot of people who have very high oxalate diets having issues with irritation in their bladder and their rectum. And I spoke to other clinicians. Again, the evidence is not out there yet, but anecdotally, that's something I've seen a lot. So there's so much importance in a conversation. She took almonds out of her diet and her anal fissures cleared up. There was nothing I could actually do for her because physically and nervous system wise, she checked out. So the conversation is really important. I then will do a postural assessment, and everybody says, oh, I have bad posture. And everybody believes they have to have that army, shoulders, back posture to have good posture. And it really isn't about that. It really is about alignment between the rib cage and the pelvis and the shoulders and the feet, creating balance within the muscles. And so this is something that I have all my clients do that I'm going to ask you ladies to do. I want you to straighten your arm for me and keep your hand nice and relaxed. And I want you to contract your bicep. Great. I want you to notice that, it moves a little bit. Now I want you to come to a 90 degree angle, and I want you to contract your bicep again. Do you feel how much more of a contraction you get than when it's straight?
Yeah.
Yes. Yeah. It feels like
huge.
And
so most of my pregnant and postpartum women live here, right? Now, I can look at what the feet are doing. I can look at what the shoulders are doing. I do that, but I really want them to understand that if we are here, our core, which works in conjunction with our pelvic floor and our diaphragm and our inner back muscles to provide spinal support and pressure management, if our core is lengthened like our bicep, it's going to show up. We're going to be able to stand and do things, but it's not showing up optimally. So if we can work throughout our day, not on having perfect posture, but having postural awareness and mindfulness and aligning, one of my mentors always says, close your bowls. So taking our rib cage and our pelvis and keeping them in a little bit more alignment, our core is going to show up so much better for us. It's going to decrease the demand on our pelvic floor muscles, which can help reduce tension. It's going to decrease the demand on our back. And a lot of women, even 20 years postpartum, have back pain and they've had all the MRIs and there's nothing going on. Their core's not showing up. Somebody in this 4-team system is not doing their job. So I spend a lot of time here helping women to understand that I have a lot of fancy exercises that I can give and I have a lot of body work that I can do. But really, if you improve your postural and breathing patterns, you can heal your core and pelvic floor. So for that mom that's at home right now saying that has 3 kids and doesn't have any time to exercise, pelvic floor therapy with the right therapist can still help you, because I add these things into things moms are already doing. If you're standing holding your baby and you are back here and you're talking to your neighbor and you can come into alignment even for 30 seconds, that's registering the brain and working on that inner TA, which is more impactful than 30 minutes of core exercise in the morning. Exercises are great, but how we hold our body all day, every day is what's going to impact our healing. So I spend a lot of time doing postural assessment, and I do my postural assessment in a way that the client really gets an experience. I want them to feel in their body the difference when I have them in alignment. I want them to see on a picture what happens when I put a grid through their body. Nobody really likes that part. And then I want them to see and feel on my body as well. I have my patients push down on my shoulders. What do you feel? I have them look at me, because when I pull them into alignment, they feel like, oh my gosh, this is not where I want to be. I feel like I'm going to tip over. But when they see it on me, they're like, wow, you're actually straight there. So our center of gravity shifts so much during pregnancy. And then we have this baby and we're carrying these car seats, or in Katie's case, 2 car seats, with a core that hasn't healed. And that's where we get a lot of pressure issues that lead to the peeing, the leakage, the prolapse, and the diastasis. So there's just so many little, again, life hacks that we can do in our everyday life to help create more strength and function. So we spend a lot of time on posture. If you have had a pelvic floor therapy session that has not talked about breath or posture, go back and find someone who does, because there's so much that can be done. I then do a breathing assessment, and I'm looking for a 3-dimensional rib cage breath, which most people who have stress in their life, a sit-down job, are not getting the full range of motion in their rib cage. But this is especially important for pregnancy and postpartum, because we become so pregnant and the rib cage flares, right? And when the rib cage flares, our core is then lengthened, so it can only show up so much for us. And the diaphragm doesn't have as much room to move, and the baby's taken up shop, right? So we actually don't have the ability towards the end of our pregnancy to get a full 3-dimensional breath, and our body compensates by breathing up and forward, it's okay. That's what it needs to do. But if this pattern stays, which in 99% of the people that I look at, it does, whether it's 2 months postpartum or 20 years postpartum, I'm finding a lot of women in a shallow breathing pattern. That is something that we work on. So I sort of re-educate them how to access that part of their body. If they can't, or if there's a restriction, we use exercise and hands-on stuff to be able to create the space that their rib cage needs to get there. But breathing and postural habits, I've seen improve leakage in up to 3 or 4 visits. I've seen it improve prolapse in up to 3 or 4 visits, and I've seen it improve diastasis, and that's without exercise. And I know that you guys, you ladies, really your expertise is in periods. So just to bring the breathing piece back to pain management, we as women have stress, right? And we have a nervous system that can be in a parasympathetic state, which is rest and digest, or it can be in a fight and flight state. This society has a lot of fight and flight, and there's a lot of things, especially if we have children, that we cannot control. There's tigers we cannot control, but how we breathe, we can control. And if we are shallow breathing and not expanding into our back, and not getting that nice side rib cage movement, which can give a visceral massage to the vagus nerve, which helps regulate our nervous system as well as the digestive system. And we know how important that is. If we're not getting that nice 3-dimensional breath throughout the day, we're using our accessory muscles of our neck and our shoulders to help us breathe. We're sending an internal message to our body that we are in fight and flight. We have enough of that. So 3-dimensional breathing is so important for pregnant women. It's so important for being in the birthing room. It is so important for postpartum healing and increasing oxygen to heal our wounds, our birth injuries. And it's really important for the pain cycle, because the more upregulated our nervous system is, the louder that pain message is to our brain. So, and women who have constipation, I have seen women improve constipation by just, again, there's fancy things I can do and I love to do them, but so many women improve through increasing their mobility, walking more, increasing their range of motion in their thoracic spine and their rib cage, taking magnesium, drinking water, and breathing 3-dimensionally. All of a sudden, the lifelong struggle with no pooping, and they're pooping. So that is the majority of my first session, is posture and breathing, and how this relates back to what you are seeing me for. And then I also look at how somebody's core is working. I work with a lot of Pilates students and a lot of Pilates instructors. And one of the biggest patterns that I see postpartum is that because the upper abdominals or the obliques were not as impacted, there is a dominance there, and it's creating pressure down on the core and pelvic floor. So a lot of women are walking around doing core exercises not necessarily correctly. So I look at the core strategy, and I'm making sure that the whole abdomen from the pubic bone all the way up to the sternum is showing up the same and is showing up in a coordinated way. And very often it's not. And this is something that can be fixed in just a session or two. It's really awareness. So that's what a typical therapy session or evaluation is for me. The next one is usually following up on any homework that I've given. And then I'm looking at the alignment of the bones, the pelvis. I'm looking at the muscles a little bit more biomechanically. What's going on with your glutes, your hamstrings? Is there an imbalance in the system that's creating pull or contributing to pain or dysfunction? And if a pelvic floor assessment is appropriate, I will often do it on the second or third visit. Would love people to know that a pelvic floor assessment it's not like getting a pap smear at the doctor. A lot of pelvic floor therapists are very trauma informed. If you have a history of sexual abuse, it's very gentle. I ask permission before I touch. I wait for my client to tell me when it's okay for me to introduce touch to their vulva or their vagina. And I'm not just looking for what their strength is. I'm looking for how does their pelvic floor coordinate with their diaphragm? Is that coordination and that movement happening? I'm looking for how tense are their muscles. Can I sink my finger into that tissue, or is it really hard and taut and holding a lot of tension? I am looking at their strength, and I'm also looking at their coordination. So not just can you contract and do a Kegel, but I like to call it a pelvic floor muscle contraction. But can you relax out of that? Because many women are walking around holding their pelvic floor tight to feel safe. And just like you can get knots in your neck, the pelvic floor is helping support the whole spine. You can get knots and tension down there. So I am looking at not only can you contract, but can you relax? And then even more importantly, can you lengthen? Are you pooping properly? Are you straining, which is going to increase your risk of prolapse, anal fissures, and hemorrhoids? So that's what typical sessions. And then it goes from there depending on what that client needs. Sometimes there's supplements I recommend. Sometimes there's specific corrective exercises or movement strategies I recommend. Sometimes a person really needs a couple body work sessions, and particularly with period issues and endometriosis, visceral mobility and myofascial release of the abdomen can be extremely helpful in providing space and reducing restriction so that the organs can function optimally and decrease pain. So I'm sorry, I could talk forever, but that's basically what sort of the first session looks like.
I got to tell you, I thought that was amazing because that's exactly what a first session with Tai Chi. So my partner is a Tai Chi instructor. That's exactly what a first session is. It's posture. It's 3-dimensional breathing. It's moving the shoulders and the ribs and the hips into alignment over the feet. It's like the exact same thing. I just launched him. We've got 2 older women who live up here with us that I have tea with on Fridays. But we were talking about Tai Chi and they were like, oh, we want to come. And they just had their first session and they were like, oh my God, I never even thought I could breathe like that. Right. Or, stand like that. So that was amazing to me.
It can be very emotional for people.
Yeah.
Yeah.
Oh, very much so. Yeah. And for the people listening on the podcast, who may not have seen the visuals, that sway back, lengthening the lower back, bringing the front of the ribs and the pelvis closer together. So you're not swaying the back and pushing the belly out, but you're not clenching and squeezing the belly in, right?
Yes, correct. That's very important.
Woman thing is like, I have to be skinny, so I have to suck it in, right?
No, not good.
It's not the same thing as sucking it in. And I think that visual of pulling the ribs down and lengthening the lower back is definitely helpful for avoiding that. And then can you still breathe into your belly? Can you still relax the belly?
I like to tell my clients, I don't want you to use your muscles to pull your bones in. I want you to move from your bones.
Mm-hmm.
It's going to keep you from building tension. And I also like my clients to know that this is really B student work. I have a lot of, type A clients that come in and they want to do everything perfectly. And I say to them, if you're going to try to change 30 years of posture in 2 weeks, you're just going to have pain somewhere else up the chain, right?
Okay.
So I want you to, when you're doing the dishes at the end of the day, try not to put your belly on the counter. See if you can stay a little bit more in alignment for 30 seconds and then increase your tolerance till it's a few minutes, right? When you're changing the baby at the changing table, when you're standing in line at the grocery store, I think that women are very hard on themselves. They'll come to see me and they'll say, I didn't do any of my homework. And I'll say, I understand. I'm the worst client. I'm the worst patient. Right? But it's not about doing your homework so many times a day for so many minutes. It's about if you worked on your 3-dimensional breathing or you thought about your posture and corrected it twice in one day, at the end of 2 years, that's like thousands of times you taught your body an optimal strategy, and that's going to mean something over time. As a busy woman, that might not mean a lot to you that you only thought about that twice today, but that adds up. And so I want women to understand that you don't have to have perfect posture all the time. In fact, I don't want you to. I want you to have postural options. I want you to hold your baby on one hip, and then I want you to be able to hold your baby on the other hip. And I want you to have a sway back, and I want you to be able to come out of that. And I want you to feel more comfort and ease and alignment than feeling like it's really foreign and like you're going to fall over.
Oh, for sure. I can't tell you how many times a day I'm standing in the kitchen and I'm thinking, oh boy, I'm sitting on my heels again. I need to get over my whole foot. Or, I'm popping this hip out. Let me just get back onto both feet. And just throughout the day, usually, honestly, it's almost always entirely in the kitchen.
Yeah.
Throughout the day, in the kitchen especially, it's very much that. And And, if I can, and I have the energy for it, drop a couple squats while I'm waiting for the pan to heat. I feel like I'm really actually like, it's a win day today.
And there's times we need to give ourselves a break. When I'm teaching women about posture when they're feeding their children, I literally say to them, I don't care what you do in the middle of the night. Just survive. Just get through the middle of the night. But if it's 9 o'clock in the morning, let's take a few extra minutes to bring the baby up to us and to let the baby cry another 30 seconds so we can get that pillow where we can get our water. Like I think that we have women in this country, they just have this want for perfection, and it's not always helpful.
Yeah,
absolutely. I see it all the time in my clients. I like this be a B student. I haven't heard that before. I like
B plus. B plus. People like the plus.
I'm like, oh, I'm sweating. I'm like, I don't know how to do that. I like that. That's an interesting way to look at it.
I got it from somewhere. I can't remember who. I'd love to give them credit, but it's had so many teachers over the years.
Yeah. Oh, absolutely. So on the same topic of like these little things that we can do at home, we are in the United States, and we're very hyper aware that people don't have insurance in a lot of cases and can't go to see a physical therapist. So I'm loving these like little tips that you're giving that people can do at home. Letting go of the sway back, right? Well, for one thing. Are there any other little like at home tips somebody can do if they think this might be the problem, but they can't necessarily haul off to a pelvic floor specialist?
Yes. Do you want just kind of basic overall pelvic health tips, or are you thinking about a specific issue?
No, I think basic overall, something that could benefit like just kind of anybody really.
So definitely the tips about alignment. So really trying to keep your heels and your pelvis in alignment. And yes, the weight's going to be more in your heels, but you still want your toes grounded on the floor, because that's going to keep that anterior fascial chain involved, right? We so much lean into our back. So I want those toes grounded, even though the weight's more in the heels. And for some people, that's enough work. We can bring the rib cage and the shoulders in later. But if that's coming easy to you, then we want to talk about aligning the rib cage over the pelvis. And we can do this in so many different situations throughout our day. And that's going to really help decrease tension in the pelvic floor. And what most people don't know is basic pelvic floor issues. 90% of my clients have tension in their pelvic floor that is preventing their pelvic floor from functioning properly. It is not that they are just weak and loose. It's that there's too much tension and it doesn't have the range of motion to do its job. And it's often doing somebody else's job. So when it comes time for that sneeze on the full bladder, it doesn't have the bandwidth to stop that. So working on your posture can really help decrease demand on the pelvic floor, which can decrease tension. Same thing with the 3-dimensional breathing. I like to tell people if they're feeling like they can't breathe into their back, I really like people to get silicone massage cups and have their partner do that on their back, just like 5 minutes a couple times a week, right? Or maybe work on the area next to their rib cage. If you don't have somebody who can manually do release, those are $30 on Amazon. And you can put them on your hips, you can put them on your belly. If you have belly pain, you can put them on your glutes, you can put them on your adductors. All of these areas impact pelvic floor health. So, and I like to tell moms to, especially if they're breathing too much into their belly, to get a pillow, come into child's pose, have their child rub their back, pretend they're poking holes into their back, and I want them to inhale, trying to fill their lungs from those holes. So that's a really great thing you can do at home to increase belly, back body breathing. And again, posture and breathing are going to help so many things. I think all women should be taking magnesium for everything. Whether they're pregnant. I am not a doctor, so I have to tell you to, quote, ask your doctor. Yes. But whether you're pregnant, postpartum, perimenopausal, postmenopausal, it is called nature's Bressack for a reason. And I think all women should be taking that. Water. Hydration is everything. The first thing that I say to my clients if they're coming to me for chronic pain is, if you're not hydrated, I cannot help you.
Yeah.
I can do all of the things, but we want our muscles and our nerves and our tissues to slide and glide on one another to prevent, restriction and inflammation. And if we're not hydrated, there's only so much that we can do from a pain management perspective. I get a little bit mean and I tell them to picture a plant. And I know for a fact that Katie struggles with keeping plants alive.
Mine are doing well here.
Oh, good. And what happens if we don't give our plant enough water? And what happens if we give it too much, right? We really want to water the plant in a certain way to help it thrive. So if you are having urinary issues and you are withholding water because you don't want to have to pee or pee your pants, you're actually contributing to the problem. So whether you have constipation, pain, period pain, urinary frequency, you're peeing your pants, if you're restricting water, you're not helping. I do tell women that in the first couple of weeks after you've increased your water, you are going to hate me. You are going to pee more. You may have a couple more accidents. It does take your body a little bit of time to recalibrate. But our bladders need balance, right? So we have a product in our kidneys called urea. It mixes with water and it creates urine. Urinary urgency is often and frequency is often a little bit about what we're eating and drinking, what's in our urine, as well as what input is coming externally from the bladder. Do we have restrictions? Do we have tension? And if we drink more, it's going to dilute the urine. It's going to be less sensitive of a bladder, and we're going to have longer, better pees. And over time, our brain is going to start sending us that true urgency at the appropriate time. So if you're peeing every 20 minutes and you're restricting fluids, I encourage you to drink more. There's also a really important way to drink more. If it's 5 o'clock and you're like, oh shoot, I'm a teacher, I'm a nurse, I didn't have time to drink all day. Let me drink 36 ounces of water to make up for it. You're not. You're just making yourself have to pee a whole lot, and you're probably going to be getting up at night, which is then going to impact your sleep. So I like to teach my women, first of all, if you're only drinking 16 to 24 ounces a day, don't drink half your body in fluids that next week. Ease yourself up 8 ounces a week per day. But I tell people to get a big water jug, 36 ounces. And I really just want, depending on their weight, I want them to get through that between breakfast and lunch, just sipping slowly. And then I want them to get through another one between lunch and dinner. If we were to chug a whole 16-ounce water bottle, our bodies would really only process 25% of that. The rest we're going to be peeing out, and people are going to hate me. You told me to drink more water, right? So drinking water slowly throughout the day will help with incontinence. It will help with urgency. It will help with frequency. It will help with pain. It will help with constipation. So that is a huge thing that you can do. Not peeing, just in case, if you're going to a place that you have a bathroom. So if you are going to the grocery store and you're in the habit of peeing just because you're going to the grocery store, but you really don't have to pee, don't. Now, if you have 4 children and they're all coming to the grocery store with you, then yeah, I would pee too, right? So you really have to pick your battles. If you're at home and you're cleaning the bathroom and the toilet's right in front of you and all of a sudden you get an urge to pee, I want you to think about, do you really have to pee? Did you just pee 30 minutes ago? Because our brain is tricky. And so when people are dealing with urgency, one of the tricks I tell people is to have your brain focus on something else and do some form of executive functioning. And it works. For me, I would pull into the garage when I had 2 children in a car seat, and the second I got in the garage, I had to pee so badly. And some people call it key and door syndrome. And I remember I would have to stop and sit on my heel midway through getting my child out of the car seat. And so what can help in those situations is actually relaxing the pelvic floor, which feels counterintuitive, but stopping, taking a nice deep relaxing breath. If you can sit. If you can't, that's okay. And doing something with your brain. So I like to tell people to count backwards from 100 by 7. So 100 minus 7 is 93, minus 7 is and that's where I get stuck. But I've had some clients do nursery rhymes. I have some people really think about what's on your grocery list. Make your brain think about that, because it's going to provide distraction and it's not going to be sending that urge, because that is a feedback loop. You may not have to pee that badly. And if you had a 36 ounces of water at the gym and you haven't peed in 3 hours, then you might have to pee that badly. But those tricks can help you get to the bathroom without having an accident. So I definitely want people to consider their just in case pees, and are they necessary?
Yeah.
I guess those are some life hacks I have.
Love it.
Those are so helpful and like practical and like so easy to think about. I grew up with like a just in case pee. It's like everyone's like in the car. Oh wait, we're leaving. I'm gonna run out back in. So I feel like it's like those habits start so young sometimes too. Like just watching. So helpful. For everyone that's listening, obviously we can hear how passionate you are. Like you're so knowledgeable. You have such passion about this. This might be hard to dial in, but what is your favorite part about working in this field?
Oh, my favorite part about working in this field is helping women feel normal with things that they don't think are normal. I love being able to make them feel seen and heard and understand that they are not the only person that can't have sex with their partner. And I think that's the most powerful thing for me. And then, when I get the email or the text message from Vegas saying I had sex with my husband and I had the best orgasm I've ever had, like that's even better. That lights me up. Orgasms are healthy, women. Everybody should be having orgasms. If you can't, you should call me.
That's what we'll name the podcast episode.
So I feel like my favorite part about this field is normalizing those taboo subjects to let people know that they are not alone, but also educating them that what you're experiencing is common, but it's not normal for your body, right? You deserve better. You do not have to pee just because you've had 5 children.
Yeah.
And if drinking wine before you have sex doesn't work, there are so many other options for you.
Yeah. Yeah, we use the common but not normal sentence quite a bit in the menstrual cycle. So I think it's a good one to just continuously hone in on that common does not equal normal. And I love that. I think that's fantastic.
Thank you.
So on that kind of same note, but now turning it around to yourself, what are some of your day-to-day self-care non-negotiables?
Oh, my self-care non-negotiables. So I'm going to be perfectly honest with you. Entrepreneurship has impacted my self-care. However, water. I drink a lot of water. I drink a lot of water all day, every day. I do take movement breaks. So in between clients, one of the biggest things that I see in my own clients is a lack of mobility in the thoracic spine. We are living our lives in one plane. We are not twisting. We don't even twist in our cars anymore because we have backup cameras. And so, I've had my own struggles with pelvic organ prolapse as well as incontinence. And the less mobile I am, the more those start knocking on my door. So movement breaks throughout the day, even if it's just a twist in between clients. For people who are working in a desk, really just getting on the floor for a minute, doing a couple cat-cows, doing a thread the needle, rotating a little bit, coming out of that, flexion posture, changing the way I sit. I sit in different surfaces throughout the day, all day. Sometimes I sit on my ball. Sometimes I sit on my stool. Sometimes I sit in a very hunched over way on the couch because I deserve it. And sometimes I sit properly and sometimes I stand. So that's a self-care non-negotiable for me. I take magnesium, thanks to Katie. And because I'm a body worker, have the luxury of trading, but I get body work good twice a month. Yeah. And it's essential for me in my field because of how much I use my upper body. And to keep my nervous system regulated, because I have all of the same stresses as most people, but I need to co-regulate with my clients in my office. So it's really important. And Most recently, I have started to learn emotional freedom technique tapping.
Love it.
And that has become a part of my day as well. And I do not have the time to, and then Katie knows I don't wake up early for anything, including meditation. But I do have a spiritual practice on my way to work. Basically, asking my higher power to remove my ego from my day, to make sure that I'm protected from, anything that somebody else brings into my room, and also making sure that, what I'm doing is in the highest good of my clients. And that's really important for people who are working with clients, especially in person and in the pelvic area. This is a very sacred space, and there's a lot there, and there is energy. And so just making sure you're keeping yourself separate, but also with good intention.
I love that. I feel like Sasha and I do similar things when we're exchanging that energy, like really protecting your energy is so important when you're helping people.
Yeah, we want to facilitate. We don't want to give our energy. We want to be a conduit.
Or take on somebody else's. I mean,
yes,
which can
that's
easily
a real thing.
Yeah. So, and most people who are going into these fields as practitioners are very empathetic, right? That's why you're in that field, because you've dealt with the pain and you've worked with other people, and now you realize, oh my gosh, I can alleviate whatever pain symptoms from other people. Let me help. Like, you wouldn't do that if you were an empathetic person. So
Right.
yeah, absolutely. How do you, keep from taking on somebody else's trauma or pain or issues, as well as you're helping guide them through it? It makes a big difference. EFT is one of my faves as well. So yeah, I like that you mentioned that. That's fantastic.
So on that note, I would love to hear, like, where do you see the future of your work and period coaching and helping more women with women's health? Like, where do you see it moving towards?
Oh, I have so many things that I want to learn, and there's only so much time. I definitely feel like I could use a little bit more knowledge in working with women's cycles. 100%. And being able to, I treat endometriosis from a very biomechanical approach at the moment, but I would love to learn more holistically, lifestyle, diet-wise, how I can help some of these clients. I am really getting into teaching. I do help teach a public health course, and I've been mentoring new therapists. And so I feel like there's only so many clients that we can help on our table. But if we have an approach that works and we can help other therapists from our own experience. So I definitely see my role in teaching increasing. And I would really, my main goal is to get into more sexual health and be able to be a sex counselor who specializes in pelvic pain. There are only a handful of sex therapists in my area, and none of them specialize in pelvic pain. And I think there's so many different levels of people who have issues with sexuality. It's not just, I need sex therapy. And so when a partner has pain, there's so much that can be done on an emotional, spiritual, mental level, as well as a biomechanical and physical level. So I would really like to see my specialty go into more sexual health.
I love
That's
it.
awesome.
I love it. Well, call me. We'll talk endo.
I would love that.
Yeah, it's I fully agree. It does feel like I could do research for my entire life and still have more things to learn and look into.
I know I only gave you guys a couple of the things I want to do.
I mean, I think that's, like we talk about this in the school all the time. Hashtag nerds. Like, we're all just hashtag nerds. So it's all right.
Lifelong learners. And a little personal note, for those who haven't picked up on it, Katie is one of my lifelong best friends. And I love, speaking of being nerdy, where our journey has taken us, because we lived in an apartment in New York City, and I was working in a traditional healthcare rehab setting, and she was in publishing. And here we are 20 years later, sharing the same referrals from physicians, sharing clients with each other, and having a podcast and both specializing in women's health because we're both addicted to learning and our individual paths have taken us to the same space, supporting the same women. So there's such a benefit to learning. And I love how our very different paths took us to the same place.
Me too. I got like little teary-eyed.
Oh,
Yeah. No, I love it.
but we will never agree on temperature.
Oh my God. Yeah. We can never live together ever again. Megan loves the cold. She like loves AC and I'm like 10 blankets on shivering.
I feel you. That's one of the things I like about women's health is that you can find a really supportive community of people to bounce questions off. Like Katie and I have been texting each other for a decade now going like, hey, I've got this client. Let me ask you a question or whatever. Or, they could use this. Let me recommend you to somebody and that kind of thing. Like the circle can be really nurturing and supportive and helpful. And that's something that I love in this space.
Yeah, it's a team approach. And 5 years into working in women's health, I still have so much to learn. But I think the best thing that we can do for our clients and for those listening, I feel like going back to the very first questions and physicians, I think one of the best things for us, some women, to hear from their clinicians is, I don't know, but let's figure it out. And so you are not going to have a therapist or a period coach or a doctor that knows everything. But if you're working with someone who's going to help you seek out that information or refer you to somebody that does, that's great, because women's health and everything that can go on, it really does take a team approach.
Yeah, this is something we talk about in the school all the time. I'm like, the magic sentence is, that's a great question. Yeah. Let's talk about it at your next session. Like,
let me find out.
Yeah, because that's exactly it. You're never going to have the answer to every question. You're never going to see every combination of symptoms and issues and have the immediate answer for it. It's just never going to happen. So great question. Let's talk about it in your next session is like the magic sentence. And that's what I want to hear too from a practitioner. Yeah. Like I want to go into a practitioner and say, here's what's going on, and have them say, okay, these are some of the things that I think we could do. And let's talk about this more in the next session, because I want them to go and, do some double checking or, whatever before they come back with an answer. If it's not something that's like their specialty, their wheelhouse, that kind of thing. So I find that, super good to hear from another practitioner, because I'm going to clip just this out and I'm going to put it in the school group and be like, see,
I love it. It's not I feel like patients and clients will feel more seen and heard by a physician who says, you're having pain with sex. I'm really not sure, but why don't you go see a pelvic floor therapist and get some support around that and let me know how that goes.
Yeah, absolutely.
And then just saying, just do this, right? That's not making a client feel heard. I think people can handle, I'm not sure, let me help you find out, better than just giving them a blanket thing to do.
I agree.
Absolutely. So where you just mentioned podcasts, but where are the places that people can find you out there in the world?
Sure. So I am on Facebook. It's Core Essence Pelvic Floor Therapy on Instagram, on both. I have a website. I think that will be listed underneath this podcast. And people are welcome to text me, email me, message me questions. I do want to say, again, along the lines of finding a pelvic floor therapist, you really want to interview them. You want to ask them questions. You want to find somebody who really specializes. If it's manual work that you need, that really has a good manual background. If you are somebody who has a lot of trauma, I'm a really huge fan of Lynn Schulte's work through the Institute of Birth Healing. And she has a list of birth healing people like me who have taken her courses and can really speak to some of the, not just the mobility and the visceral mobility and the fascial release work that she does, but the birth trauma work that she does and the healing work that she does. So that's a really great list. If you're out there anywhere in the country, that you can find a pretty holistic practitioner as well.
I love it. That's fantastic. Great recommendations. Okay, so before we let you go, we have a rapid fire question round where you just have to tap in and go with the first answer that springs to mind.
Okay.
Ready?
Yes.
All right.
Let's everyone take a 3 deep breath.
Love it.
All right, first question. What's your biggest craving?
Fried food. I don't let it happen often because I know, but it is my biggest craving.
Oh, same. When I did my first cleanse, like not eating junky stuff, I went out the night before and ate all of my favorite fried foods from every restaurant in downtown LA.
I can't actually eat a lot of it anymore now that I eat clean, but like an onion ring.
I'm really glad I did it because I can't eat any of it anymore. So I'm like, to this day, I'm like, oh, thank God I went and binged that one day.
Mm-hmm.
Well, what do you eat to satisfy your craving? Question 2.
I just don't keep it in the house.
Yeah.
I know what I'm supposed to eat because I've trained with Katie and it has worked. Katie helped me clear my cystic acne. But I don't know that I remember offhand. I just try to eat something healthy to fill my stomach and drink water. Or I have 2 potato chips and then stop.
What's your favorite way to move?
Favorite way to move? I love yoga.
What's the number one self-care that you do when you're stressing?
I would say right now it's tapping.
Yeah, love it. What music do you like to listen to when you're working? Maybe not with a client, but maybe doing the back end stuff in this case.
True. I really like singer-songwriter folk music, but honestly, when I'm doing the back end stuff, I like to watch old girly TV shows from the 90s and have them on in the background.
Nice. What's the favorite?
90210.
Love
The
it.
original, right?
The original, yes.
I love that.
Right now I'm on the OC and it's just on in the background. I don't have to pay attention because I know what happens, but that's my work music. Because I don't have time to watch TV in my real life. So they're
Oh, I love it. Seth Cohen. I feel like someone else had mentioned Seth Cohen too. So maybe it was me. I don't remember. What's your favorite country or place that you visited?
New Zealand. Hands down.
Yeah.
What's your favorite holiday?
Christmas. But I'm so glad it's over.
What food do you not like?
I don't like lasagna.
Really? Wow. That's a first. I love it. I love you.
Yeah, I've never liked it. I know people make them. When people have you over for dinner, they always have lasagna, and I'm like, oh, I don't like lasagna.
Pumpkin spice, yay or nay?
Yes, but not until October. None of the August stuff.
Do you cook?
Starting to. I don't cook. I've never been good at it and I don't like it. But my current partner and I together have 5 children. So when we get together, it is cost effective. So I have started to play with cooking again.
I feel that. Favorite place to work?
On my couch.
Mm-hmm.
And
I love being in my office with clients, but I do like sitting on my couch with the OCM in the background.
Yeah.
I like my couch too. What's your ideal Friday night these days?
These days is children are in bed and either with my partner or by myself, a glass of wine and a good movie. Or a book.
Seen anything good lately?
Yes, I watched The Boys in the Boat.
I haven't heard of that.
Yeah, it's a true story about 1936 Olympic crew team from Washington University.
Oh,
It was a JV first-time team that made it all the way to the Olympics. George Clooney, it was really beautifully done. George Clooney directed it.
add that to the list.
Why I didn't call you on Saturday.
Oh, amazing. I love it. That's the speed round. Well done.
Thank you. That was fun.
For that.
That was fun.
Any final questions before we wrap it up?
I guess my question would be, when you're treating people for the period and endo, do you find is the biggest issue that they could benefit from pelvic floor therapy?
I feel like in my experience, it's been the manual therapy,
Yeah.
like the abdominal massaging.
Yep.
I would have to like go and ask. I'm not sure how much internal work they were doing. I know initially it was all like lots of cupping
Yep.
and lots of like manual abdominal massaging.
Yeah. It helps so much. Yeah. Great.
Yeah. Especially if you have a client who has had the surgery and they know where the growth, the scar tissues, the organ fusions, those kind of things are, because they're, typically around the uterus, bowel, bladder, colon, because it's that centralized area. But I've had clients that have had it on their small intestine, large intestine, all the way up. You can have endometriosis in joints, lungs, heart tissue. I mean, people die from it spreading into those kinds of organs as well. So especially if you have somebody who's, has an actual map of where it is, that manual relaxation and release. And endometriosis is a condition of contraction in a lot of ways, because you're constantly braced against the incoming pain. Like, it's coming. There's no way around it but through. There's nothing you can do because you've tried all of the things and nothing helped, right? Like, you tried all of the pain meds and the birth controls and the surgeries, and it just comes back and all those kinds of things. So you're constantly braced against the storm. Learning to relax is probably one of the hardest things to do, because you have all that anxiety and trauma. So getting through that anxiety and trauma to be able to relax, which of course, as you know, helps reduce the pain, but it's so hard to do because you're so just every fiber of your being is like, I have to brace myself against what's coming, that it's very hard to rewire your brain and to be able to breathe, to be able to relax, to be able to let it to let it go and to release it, which, most people with endo end up in a scalding hot bath because it helps to relax and release.
Yeah.
Heat is often one of the things that works against the pain. It helps. It's like really strong ginger tea is one of the things that work with endometriosis pain. It helps better than ibuprofen by most accounts. It does have to be strong enough to burn your mouth a little bit, but it does work in a way that that pain meds don't work. So it's kind of that, like, how do you release and relax, and and then getting that scar tissue or those abrasions and lesions to disconnect, release, organs fuse, get those to pull apart again. All of that can be really impactful.
Nervous system is such a huge part, and one of the things that I really love about manual work and just nervous system work in general is many of our clients that have this pain, they don't even know what it's like to experience being downregulated, right? And so on our table, yes, we're doing manual work. Yes, we're helping release restriction, but we're also giving the client an experience of being in a more parasympathetic state, which they might not have experienced before. And then how can we then give them the tools to create that at home?
Yeah, absolutely.
Awesome. Love it. Well, this was so much fun.
Thank you so much for having us. I feel like I learned a ton.
I feel like I always over talk, but I'm just there's just so much to say.
No, I'm fascinated, and I'm sure that anyone listening feels much better about setting up an appointment, knowing that they don't have to continue on with that practitioner, right? We always have that pressure. So I think just taking that pressure off right out of the top is very helpful. And B, knowing what a session really can look like instead of this fearful unknown mystery, right? Which is kind of the point of the podcast, is pulling back that curtain and getting rid of those mysterious circumstances so people can go get the help they need.
Right.
And I think that this was hugely illuminating, and I'm hoping that a whole flood of people are like right now on the phone with their providers going, who is my pelvic floor person?
Love it. I love it. Thank you for the opportunity.
All right. Thank you so much for being here. Thank you so much for joining us today. Thank you everyone who is listening. I hope that we will see you in the next episode. Of course, like and subscribe as always. And we will see you in the next session. Thanks so much and bye for now. A big shout out and thank you to our sponsors for today's episode, Period Coaching School and Katie Bressack Wellness.
Thanks to you, our favorite bestie, for listening to the Period Besties podcast, where no topic is TMI. And of course, share this episode with your besties.
Remember to leave us a 5-star review, nothing less than the best for us besties, and subscribe wherever you listen to podcasts.
You can follow us on Instagram at Stasha Washburn and at Katie Bressack, or email us at periodbestiespodcast@gmail.com.
Check out more about us at katiebressack.com and periodcoachingschool.com. And of course, check the show notes for free goodies and extras that support this episode.
We'll see you on the next episode.
Bye for now, besties.